coagulase positive Staphylococcus species are species specific, we can say, because in some species are found only in some animal species or animal hosts. For humans, as we know, the coagulase positive species is Staph aureus. 30% of humans are colonized with Staph aureus, and they are like have a risk to develop the infections when they have the underlying conditions. Okay, and Staphylococcus aureus can also um, be isolated from various animal species, both food animals and companion animals. For companion animals, in dogs and cats, the major species is Staphylococcus subintermedius. Okay, so we need to remember. Okay, more. One is aureus. Okay, next is subintermedius. The less common species in dogs and cats is coagulans. Okay, and in pigs, the most common and problematic species is Hyaccus, Staphylococcus hyaccus. Hyo is the root for pig or swine. Okay, aureus, subintermedius, coagulans, Hyaccus. Okay, we need to remember because we are vet. Okay, veterinarians. And next we will learn about the bacterial pathogenesis and the virulence factors. Okay, we will talk about this in every species. But I introduced in the part of
Next week,
Staphylococcus. When
learn
bacteria
about
uh,
real
colonize or cause
factors.
disease,
Okay, we
okay,
will
they need to
in
start with
every
attachment
species combat and use in
or
part.
adhere to the host. So they need the adhesion molecules for adhesion step. And the next, the bacteria will use the nutrients and multiply it. At the site, we call this is the colonization step. For commensal bacteria, okay, they will just colonize without any harmful steps. But for pathogenic bacterial species, they have the virulence factors for invasions, such as toxins. The toxins will destroy the tissues or the host cells and cause the inflammation and like induce the inflammations. So the next is tissue invasions. Yes, and of course, the pathogenic bacterial species need to evade the immune systems or the immune response from the host by different methods. Okay, for the Staphylococcus, the first step is adhesions. Staphylococcus has the surface molecules or the surface proteins. We call the surface proteins that help the bacteria to attach to the host as the microbial surface components. Okay, this is a components on the microbial surface that recognizing adhesive matrix molecules or MS cramps. The word or the term is very long, so we call MS cramps. And this is the microbial surface components that recognize the host tissue. These surface proteins bind extracellular matrix proteins of the host. Okay, like this is from the bacteria. This is like on the host cells, like a lock and key. Okay, the extracellular matrix proteins of the host is a part of tissue or connective tissue such as fibronectin, laminin, and collagen. Right? We need collagen to look young. Okay. For the bacteria, if the proteins on the surface that bind fibronectins, we call fibronectin binding proteins of bacteria of Staphylococcus. Okay. The proteins that bind to fibronectin of the host. So we call this is the fibronectin binding protein of Staphylococcus. This determined the host and tissue specificities, like lock and key theory. Why some Staphylococcus can attach and colonize only in these host species. Because of the first step of adhesions. After the bacteria colonized and for causing disease, they need virulence factor for invasions. Staphylococcus, especially the pathogenic species like aureus, subintermediates, they can produce hemolytic toxins or hemolysins. This is the toxins that cause cell membrane damage. We can see the activity when we culture the bacteria on blood agar. The toxins released from the bacterial cells lyse the red blood cells in blood agar. This not only lyse red blood cell, they can lyse the many cells, including white blood cells and tissues. We call this is the cytolysin. This is a toxin that damage cells. Okay, but we can see in vitro using blood agar, so we call hemolysis. This is complete hemolysis or beta hemolysis, and this is partial hemolysis or alpha hemolysis. Okay, and in some staphylococcal species, such as aureus and hyaccus is in pig, right? They can produce exfoliative toxins. Okay, the exfoliative toxins is a toxin that cleave or cut desmoglein. Desmoglein is the intercellular adhesion proteins. So this is the histopathology of pig skins. For experiments, the researcher inject exfoliative toxins. These can cause the detachment of epidermis from dermis layers. So why we call exfoliative toxin? Because the toxin cause exfoliations. For the Staphylococcus hyaccus that produce exfoliative toxins and cause disease in pigs, the disease is exudative epidermitis. Okay, we will go to the detail later. We know adhesions, we know invasion, and next is immune evasions that are the virulence factors to help the Staphylococcus to evade the immune response. Okay, for the pathogenic species, coagulase positive Staphylococcus, they produce the coagulase enzyme. What is the function of coagulase enzyme? The coagulase enzyme can induce the coagulation cascade in host. For the coagulations, the product is fibrin, right? And the fibrin will cover the bacterial cells. So this cover the antigenicity of the bacterial cells that help the immune evasion by resisting to phagocytosis. Okay, that's why the coagulase positive species are more pathogenic because they can evade the immune systems. And also, the another virulence factor for immune evasion is staphylococcal protein A. For the staphylococcal protein A, see on the right side, okay, the protein A is in yellow, will capture the FC portion of immunoglobulin antibody. The FC portion is the recognition part of antibody by phagocytes before phagocytosis. When Staphylococcus produce the staphylococcus protein A on the cell surface, this will inactivate the immunoglobulin at the FC portions. So the phagocytes cannot recognize and cannot initiate the opsonization and phagocytosis. Okay, so the strains that produce staphylococcal proteins A will help the immune evasion by resisting to phagocytosis also. And the next, some Staphylococcus strains, especially Staphylococcus aureus, can cause food poisoning by toxic shock syndrome toxin 1 production, or we can call TSST1. The toxic shock syndrome toxin is a heat-stable toxin. When the food are contaminated by Staph aureus or contaminated with these toxins, okay, and the people eat it, the digestive enzyme cannot destroy the toxins. This will be absorbed through the intestinal tract and cause systemic inflammation because the toxic shock syndrome toxin is a super antigen. What is super antigens? In the normal process, the antigen presenting cells that process the antigens inside the cells, yeah, we can see the greens. The antigen presenting cells use MSC class 2 to present the antigens to T cells. This is T cell receptor or TCR. And this is the specific activation of T cells. This is the normal process. But for super antigens like toxic shock syndrome toxins, this will activate via the MSC class 2 to T cell receptor without any specificity. The superantigen activate the multiclonal T cells and induce the pro-inflammatory cytokines. We can say this is the cytokine storm to um, promote the systemic inflammations. So the bacteria contaminate in food or the toxins contaminate in food. So this is a cause of food poisonings in public health importance. For clinical importance, Staphylococcus in humans can cause skin and wound infections and sometimes cause the closed lesion like abscess with the pus inside because there is the accumulation of neutrophils, right? And in hospitals, the Staphylococcus aureus can cause nosocomial infection. This is the synonym of hospital-associated infections. And the disease is more severe and can cause the systemic fatal outcomes such as pneumonia, bloodstream infections, and urinary tract infections. Because for the patients, they need some medical interventions such as the endotracheal intubations to help um, to use for a ventilator usage, and also need intravenous catheterizations, okay, for fluid therapy, and sometimes needs uh, the urinary catheterizations to determine the urine output. Okay, these are the risks for introduction of bacteria uh, inside the body. Okay, and for animals, Staphylococcus aureus can also cause disease in various animal species, such as in dairy cows. This is a cause of bovine mastitis. And also for animals that are stand on the cage for a long time, this can induce the chronic inflammations and cause the subcutaneous abscesses. This is a form of bumblefoot, especially in birds and in rodents. For small animals, in dogs and cats, Sud intermedius is the most common species, followed by coagulans and aureus. Uh, in clinic, in the dermatology clinic, yeah, okay, we will see many cases of staphylococcal pyoderma after the dog with underlying conditions such as skin allergies, they will develop the skin lesions. And this can cause wound infections and otitis externa. This is the skin and soft tissue infections. Moreover, staph sud intermediates, coagulans, and aureus are associated with health, the hospital-associated infection in veterinary medicines, same in human hospitals, like urinary tract infections, bloodstream infection, and surgical site infection after surgeries, and cause the osteomyelitis. What is your diagnosis? This is a case of a Chihuahua dog with the presence of chronic skin lesions. This is the secondary lesion of the skin conditions after chronic inflammations. You can see from the histopathology. Um, this is the keratinized epidermis, right? And this is the higher magnification. We can see the keratins, many layers of keratins, and many microbial multiplications. When we zoom, this, what is this? This is a cell, right? This is corneocyte of skin. Yes. And these are fungal microorganisms. What is this? These are Malassezia pachydermatis. And the tip of arrow is Staphylococcus. Okay, so with the presence of skin conditions, there are multiplications of skin microflora and also induce inflammations as a cascade. And this is the lichenifications you will learn in dermatology. And the next is Staphylococcus hyicus. Okay, Hio is pig. The Staphylococcus hyicus produce exfoliative toxins and cause exudative epidermitis, or we can call the greasy pig disease because of the grayish brown exudates. Okay, the predisposing is just the nursery pigs with the weak immune development. Okay, we can see some weak piglets developed greasy pigs in the farm. And of course, because Staphylococcus is a member of ESKAPEE pathogens or the escape pathogens, so they have the specific resistance of public health and clinical importance. The antimicrobial resistance of Staphylococcus that are highly concerned is methicillin resistant staphylococci or MRS. Most two important species are aureus and Pseudo intermediates. Okay, so we can call MRSA or MRSA for aureus. And for Pseudo intermediates, we call MRSP, stand for Pseudo intermediates. The resistance called methicillin resistant, but the property is not resistant to not only methicillin. This is just the name. The properties of methicillin resistance is resistance to beta-lactam antibiotics. Okay, beta-lactam is a big group of antibiotic or antimicrobials that are widely used in human and veterinary medicines. Staphylococcus develop methicillin resistance by acquiring MEC genes. Okay, MEC gene is the genetic determinant of methicillin resistant Staphylococcus and not resist to beta-lactams. Methicillin-resistant Staphylococcus can be multi-drug resistance or MDR by accumulation of multiple antimicrobial resistance genes in their genome, right? This picture, this is a cartoon, show that the bacteria can transfer the antimicrobial resistance gene to other. Uh, this one, like methicillin resistant Staph aureus, okay, ask this one, pass, hey kids, want to be a superbug. Superbug means antimicrobial resistance bacteria. Okay, and they send something, right? Stick some of this into your genome. This is make gene. Okay, even penicillin won't be able to harm you. Just stick MEC-A into your genome, and then penicillin, this is a kind of beta-lactams, won't be able to harm you. Okay, they can transfer the genetic material to other bacterial cells. This process is horizontal gene transfer. Uh-huh, for antimicrobial resistance development. Okay. Uh, the MRSA, okay, of course, this is first described in human and cause hospital-associated infections and um, followed by the discovery in many animal species. In livestock, there are specific clones of MRSA. We call livestock associated MRSA. Okay, this can be transferred to human, especially in farm personals. I found the identical livestock associated MRSA strains transmit from pig to humans in the farms. And also, MRSA can be uh, detect in companion animals. And in companion animals, there is MRSP. This is the specific species, so intermediates. And in my PhD dissertation, I characterized the strains from dogs and cats. Oh, sorry, from only the dogs. That is identical to those found in dog owners and veterinarians. Okay, so this is a risk for an occupational risk for colonization of antimicrobial resistance bacteria. Okay, we finished Staphylococcus, and the next is Enterococcus. Enterococcus is also a gram-positive toxide, but these colonize intestinal tract of humans and animals. Previously, Enterococcus was a member in Streptococcus, but Enterococcus can grow in high salt concentration up to 6.5%. This is a kind of halo or salt tolerance bacteria. Enterococcus faecalis and Faecium are most important species that can turn from normal flora to opportunistic pathogens. For antimicrobial resistance monitoring, Enterococcus faecium and faecalis represents the commensal populations of gram-positive bacteria. Like these are markers for monitoring of antimicrobial resistance in commensal gram-positive bacteria. The surface proteins of Enterococcus can help them to colonize on the surface of medical devices and promote the biofilm production. Okay, for the biofilm production, this is that helps them to resist to antimicrobials and also prevent from the immune response of the host. If the bacteria contaminate during the catheterizations, the bacteria can use the surface proteins to attach to the surface of the catheters and colonize and then cause the infection of urinary tract because Enterococcus is one of the most common nosocomial and opportunistic pathogens that contaminate in the hospitals. And also for the bloodstream infections, the enterococcal cells can spread through the bloodstream and attach to the endocardium or the heart valve and cause endocarditis by inducing the chronic inflammations. One of concern, Enterococcus have many natural or intrinsic resistance mechanisms to various drugs. Okay, natural or intrinsic resistance to various antimicrobial drugs that cause very difficult to treat. For example, you can see the results of antimicrobial susceptibility testing from a dog. The dog had a post-operative abdominal effusions. And for the bacterial culture, we found Enterococcus faecium. Enterococcus faecium has many intrinsic resistance mechanisms that show in gray shades. Okay, the gray show the drugs that cannot be used to treat Enterococcus. Okay, and for the red show R. R is resistance. That means this Enterococcus faecium develop the resistance by development of resistance mechanisms to the drugs that the wild type are susceptible. Okay, we can say this is extensively drug resistant strain or XDR means the bacteria show resistance to almost drugs we test. So there is only one drug in white and show S. S is susceptible, okay? Susceptible to only vancomycin. Vancomycin is the last line antimicrobial for gram-positive bacteria. Okay, vancomycin. Okay, we remember. For chloramphenicol, this is no longer used in human and veterinary medicine because of the toxicities. Okay, so in this case, we need last line antimicrobials, vancomycin for the treatment. What is vancomycin? Vancomycin is a glycopeptide group. This is a last line for treatment of serious gram-positive bacterial infections. So we need to conserve this drug. The mode of action of vancomycin is vancomycin inhibit dealanine. or we can call the alanine dimer. The alanine dimer is a component of peptidoglycan here. Okay, when vancomycin inhibit the alanine dimer, the bacteria cannot do cell wall, cannot complete the cell wall synthesis. Okay, this is the normal mode of actions. But Enterococcus can develop resistance to vancomycin. We call vancomycin resistant enterococci or VRE. Uh-huh. The two most common species, including Ficolis and Physium, can acquire the plasmid containing Van gene. Okay, for Van genes, uh-huh, the Van genes can help the bacteria to produce the alanine lactate, right? The alanine lactate, okay, to use to be used instead of the alanine dimer. For the wild type, right, when they produce the alanine dimer, this will be inhibited by vancomycin. For the resistant strain, they can produce the alanine D-lactate to be used instead of the alanine dimer. So while VRE can continue peptidoglycans or cell wall synthesis with the presence of vancomycin, resulting in vancomycin resistance. Um, in human hospital, this is highly concerned because the last line antimicrobials cannot be used to treat vancomycin resistant enterococci. In veterinary medicine, uh, in the year before 2000, a drug called avoparcin. This is a lesson learned. Avoparcin is a glycopeptide used as a growth promoter for livestock. This is a molecule of avoparcin in glycopeptide. This is the same group with vancomycin. So the bacteria can develop resistance to avoparcin and cause cross resistance to vancomycin. Okay, because they use the same mechanism of resistance, and avoparcin and vancomycin are in the same group. And then the VRE from livestock can contaminate the food products and transmit to humans. And when humans are colonized with VRE, this is a risk to develop infections when they have the predisposing conditions, right? Okay, this is a cause why European countries banned the use of avoparcin first in 2001. When avoparcin was banned, the prevalence of VRE in hospitals was decreased. Okay, we can see the link of the selection of antimicrobial resistance and transmissions between sectors. This is a lesson learned. Okay, and then the use of antimicrobials as a growth promoter was banned. We use only for treatment. And just the study from our group we investigate the contaminations of antimicrobial resistance bacteria in raw meat-based diet for pets. This is a trend. Now it's a trend for pet parents. We choose, and the owners like to choose the um, food, uh, the good foods for their pets, and some choose barf or raw meat-based diet. But this is a risk because there are many foodborne bacterial species contaminate in the raw meat-based, the commercial raw meat-based diet because we purchase from the pet shops and also from the online. 100% are contaminated with Enterococcus faecalis and Faecium. So this is a new pathway for the transmission of Enterococcus from livestock animals to pets. And this is not only contaminated by foodborne when the owner prepare food, right, in the household, in the kitchen. Uh-huh. So there might be some contaminations in the household environments and to dog or cat owners. Yes. Okay. Would you like to take a break or we can continue, Shruti?
You can continue,
Okay.
doctor.
Okay. Okay. We continue with the gram negative. For the gram-negative bacterial species, okay, we start with the order Enterobacterales. The order Enterobacterales. The type species is E. coli. E. coli is used for antimicrobial resistance monitoring because this species represent the commensal population of gram-negative bacteria. Same, similar to Enterococcus represent population of gram-positive bacteria. Okay, these two species are used for AMR monitoring. For Enterobacterales, before we call family Enterobacteriaceae. And the species that we are talking, Escherichia klebsiella and Enterobacter are Enterobacteriaceae family and is in the Enterobacterales order because there are some revisions since 19 sorry 2019 in some species such as Serratia was divided into Urinaceae family. So this is just the taxonomic revisions. For Enterobacterales, they are commensal flora in the intestine and some gen some genera and species cause intestinal diseases. So the outcome is diarrhea by enteritis. Okay, this is the clinical importance. And moreover, the Enterobacterales can cause extra intestinal infections or disease, such as urinary tract, respiratory tract, bloodstreams, surgical site infections. Depends on the site. Okay, because they have the virulence factors to promote. For E. coli E. coli is a type genus of the family Enterobacteriaceae. For the classifications based on their pathogenicity, some strains, I think most strains are commensal E. coli. So I can confirm in the intestinal tract of all of us are colonized with commensal E. coli. They are not harmful and we are healthy, right? And there is a group of E. coli that cause disease. This is a group of pathogenic E. coli. Okay, this is a group of pathogenic E. coli. That means they have virulence factors that promote their pathogenicity. Okay, and the disease caused by pathogenic E. coli infections we call coli bacillosis. We need to remember this term, the disease caused by E. coli called coli bacillosis. Okay. Within pathogenic E. coli, pathogenic E. coli can cause intestinal infections or diarrhegenic E. coli. The disease is limited to the intestine. Okay, and the another group is extra intestinal pathogenic E. coli. Okay, extra intestinal pathogenic E. coli. This cause the disease outside intestine. For the disease caused by pathogenic E. coli needs different virulence factors and show different pathological abnormalities. So the E. coli can be classified into different pathotypes. Okay, we need to remember the word pathotypes. Pathotypes or pathotyping. This is a typing of E. coli based on their pathogenicity and virulence. Pathotyping is a classification of E. coli based on pathogenicity and the major virulence factors. For diarrhegenic E. coli, there are many pathotypes. Okay, but today we will focus on two important pathotypes. The first one is enterotoxigenic. We need to correct from the handout. Okay, I update to be enterotoxigenic. Enterotoxigenic, E T E C, E-tech. Enterotoxigenic or E-tech is a pathotype of diarrhegenic E. coli because they have a specific toxins. Okay. And next is enterohemorrhagic E. coli or E-HEC. E-HEC has a different toxin that cause a different disease. This is a pathotype of E. coli. And for extra intestinal pathogenic E. coli, for example, avian pathogenic E. coli or apoptotic APEC, APEC. APEC has a specific virulence factor that cause extraintestinal infections in avian species. Okay, we will go to the detail later. For the pathotypes of E. coli, the ETEC or enterotoxigenic E. coli has F4 and F5 fimbria. Fimbria is a structure outside the cells of E. coli that help the attachment or adhesions to the intestinal cells. And F4 and F5 fimbria are specific to the intestinal lining of piglets and newborns. Only piglets. This is the age specificity and cannot attach to the mature pigs. Okay. And after the attachment and adhesions, okay, they can produce enterotoxins to cause diarrhea in piglets and newborns. Okay, this is a pathotype of E. coli, ETEC. And EHEC, enterohemorrhagic E. coli, produce Zika toxins, right? This is a different toxins from ETEC. The Zika toxins affect the endothelial cells and cause hemolytic uremic syndrome in humans or edema disease and in pigs. And APEC or avian pathogenic E. coli has a specific fimbria to attach to the organs of avian species and cause coli bacillosis in poultry. APEC can cause pneumonia and asacculitis in poultry. And UPEC is uropathogenic E. coli that have a different fimbria called mannose-sensitive fimbria that adhere to uroepithelial cells in the urinary bladder and cause urinary tract infections in humans and also in dogs and cats. These are extraintestinal pathogenic E. coli. For ETEC, again, just to review, ETEC or enterotoxigenic E. coli, ETEC pathotype has fimbria to attach the epithelium of piglets or newborns. This is the age incident. And after colonizations, ETEC produce enterotoxins. Enterotoxins are exotoxin of E. coli that are secreted from the bacterial cells. These can impair or disturb intracellular signaling pathway inside the intestinal cells. And the overall outcome is the release of sodium chloride ions and water into intestinal lumen and cause diarrhea in piglets. So The enterotoxigenic E. coli is the cause of swine coli bacillosis in neonatal pig. We can say this is neonatal or post-weaning diarrhea. Okay, this is the veterinary importance of E-tech. And the next is EHEC. EHEC or enterohemorrhagic E. coli. EHEC produces Shiga toxin. So the Shiga toxin prototypes found in Shigella dysenteriae. The synonym of ETEC, of EHEC is Shiga toxin producing E. coli or STEC. This is the EHEC cells in the intestine. Okay, in green. When they produce Shiga toxin, the toxin is absorbed through the intestinal lining through the blood stream. The target of Shiga toxin is endothelial cells in the blood vessels, right? The Shiga toxin can cause endothelial cell apoptosis or damage and induce inflammations. This is the formation of fibrins and the coming of platelets. When the platelets produce fibrins, this can cause hemolysis when the red blood cell pass this area. Okay, why we call this is enterohemorrhagic. This is a severe disease because the systemic signs can cause a septic shock. Enterohemorrhagic E. coli or EHEC was outbreak in the US and found the serotype is O100H, O107 S7. O157H7. This is the first serotype of EHEC, or we can say this is the prototype of EHEC characterized. And the reservoir of EHEC is the cattle. EHEC cannot cause disease in cattle because they lack the receptor on the surface of endothelium. So cattle can act as a reservoir and also shed into the environment. So EHEC contaminate the environment and also contaminate food, like when we cook hamburger with medium rare. Okay, the inside is not well cooked. And if there is contamination of EHEC, so that we can ingest, and this can cause the disease. So this is a zoonotic pathogen. EHEC is a zoonotic pathogen that cause hemolytic uremic syndrome or HUS in humans. The uremic is caused by the Shiga toxin destroy the endothelial lining of glomerulus in kidney. So there is the retention of urine of the urea in the blood. So this is a uremic. Okay. For EHEC of veterinary importance, EHEC can cause edema disease in pigs. In some strains of E. coli, they have the STX2. This is like the toxin similar to Zika toxins, but this cause disease in pigs. The mechanism is the same because STX2 cause endothelial cell damage. Okay, that can cause the vascular leakage from blood vessel to the intestinal tissues. Uh, for pigs, we can see the lesions such as subcutaneous edema of the forehead, the wall of stomach, and mesocolon, and there is infarction of the brain stems and can cause the neurological signs of the pigs. The toxin is produced from the E. coli in the intestinal tract and absorbed to the blood vessel. We call this is enterotoxemic coli bacillosis in weaned pig. Enterotoxemic is an adjective, means the toxin produced from the bacteria in the intestine, and the toxin is absorbed into the blood to be toxemia. So we call enterotoxemic coli bacillosis in pigs. So we can see a different serotypes from that found in humans, 0157H7. Okay, this is the importance of EHEC in pigs. And next is extra-intestinal pathogenic E. coli. Okay, extra-intestinal pathogenic E. coli. This cause disease outside the intestine because they have virulence factors promoting survival outside the intestine, such as the fimbriae that adhere to extra-intestinal tissues and have the capsules for immune evasions and have the host invasions virulence factors. In avian species, APEC or avian pathogenic E. coli is the cause of coli bacillosis in poultry. Coli bacillosis in poultry caused by the penetration of APEC and throughout the body and cause respiratory and systemic infections. The birds will show diarrhea and respiratory distress because of the pneumonia and ascites. And also we can see the inflammations of heart, pericarditis, of the ovary, salpingitis, and also panoptomitis during the necropsy. For dogs and cats, as well as in humans, some strains called uropathogenic E. coli, sorry, this is a repeat, uropathogenic E. coli or UPEC. UPEC has a specific fimbriae for the attachment of the uroepitheliums. So the use of catheterization is a predisposing factor to introduce UPEC into urinary tract. And not only urinary tract, in canine species, UPEC or XPEC can also cause pyometra. They have the same virulence with uropathogenic E. coli because of the hormonal imbalance or hormonal predisposing factor in female dogs. The enterobacterial layers, before we talk about only E. coli, but the extra intestinal pathogenic E. coli, as well as Klebsiella pneumoniae and Enterobacter cloacae are members of ESKAPEE pathogens. They colonize the intestinal tract and can be excreted to contaminate environments and cause opportunistic infections in many forms, like we described before. They have the similar virulence factors, especially the virulence factors that help immune evasions and cause inflammations. So we can see the colonies of Klebsiella enterobacter. They present the mucoid colonies because they produce the capsules. And some strains of E. coli can also produce hemolysins that show hemolysis on blood agar. Klebsiella, Enterobacter, and E. coli are coliform bacteria. This is the indicator for hygiene, right? And they can grow on McConkey agar and utilize lactose and produce acid with the presence of pink colonies from the acid conditions. They are coliform bacteria and lactose fermenter. Okay, they can utilize lactose. This is the shared characteristics among Klebsiella, Enterobacter, and E. coli. They are in the member of Enterobacterales and associated with nosocomial infections and develop resistance to last-line antimicrobials, including third-generation cephalosporins and carbapenems. So I show you a case from a dog admitted to the critical care unit and develop bloodstream infection. Okay, a pity dog. And from hemoculture, we isolate Klebsiella pneumoniae. They show multi-drug resistance in red with R, right? Except only imipinem. Imipinem is a drug in carbapenem group. This is a last line antimicrobial for gram-negative bacterial species. So, like I described in Enterococcus, we can say this is extensive drug resistance or XDR. Okay, this is very harmful. And the bacteria can develop carbapenem resistance later. Yes, because before COVID outbreak, we observe the development, like the increasing of frequency of carbapenem resistance, gram-negative bacterial species. From first was isolated in 2016 and increased in 17, 18, 19 from the data collections, because in Enterobacterales, we found a spread of carbapenemase gene production. These genes like hydrolyzed carbapenem drug molecules. The genes that encode carbapenemase are on the plasmid, and this can spread among enterobacteriales species. They share by horizontal gene transfer. Okay, on the plasmid, they can share by conjugations. And we can see the development of the plasmid and the plasmid evolutions. So this is uh, our observation in patients' wards in small animal hospitals. So we identified the use of the drugs in animal hospitals makes the inpatient wards to be the high risk unit. So for the last group is the non-fermenting gram-negative bacilli. Okay, non-fermenting means they use glucose only in the condition with the presence of oxygens. For non-fermenting gram-negative bacilli, they are ubiquitous bacteria. The common habitats are environment, but these are highly concerned in hospitals. They contaminate hospital environments and also the medical devices. And these are members of ESKAPEE pathogens, and of course, they cause nosocomial infections with the presence of conditions, especially the systemic infections. The carbapenem resistant Acinetobacter baumannii has been reported with higher frequencies. So this is classified in critical groups, but 2 years ago, the WHO reclassified Pseudomonas into high group because of the lower prevalence. Anyway, for both species, they have the virulence and high resistance to antimicrobials. For the common virulence, they have the adhesins, right? This is the first step of bacterial pathogenesis. Before they colonize, they need to attach using the cell surface such as fimbria in gram-negative bacterial species. Okay, and for the gram-negative bacterial species, they have lipopolysaccharide. This is endotoxin to induce inflammations. And in gram-negative bacterial species, when they secrete the toxins, they use the secretion system. The type 3 secretion system is one of the most important that inject into the host cells and secrete the toxin to cause the host cell damage. And they can also produce the capsule and biofilms to prevent them from immune response and from antimicrobial penetrations. For Acinetobacter, the shape of the cells is shorter. So we can say this is a gram-negative coccobacilli, while Pseudomonas aeruginosa is gram-negative bacilli. Acinetobacter is non-motile, but Pseudomonas is motile. Acinetobacter is oxidase negative, but Pseudomonas is oxidase positive. These are the primary test characteristics that we can do for differentiations between these two species. For Pseudomonas aeruginosa, this species is the most important with the production of important pigments. When we grow Pseudomonas aeruginosa on King A agar, this condition induces the production of pyocyanin. Cyan is blue. This is a kind of virulence factor of Pseudomonas aeruginosa that produce reactive oxygen radicals to damage the host cells. And on King B, Pseudomonas aeruginosa produce pyoverdin, or fluorescein. Fluorescein is fluorescence, means the colonies is fluorescence in yellow, right? This is also a virulence factor of Pseudomonas aeruginosa. We call this is a kind of iron acquiring system or siderophore that capture iron from the environment to cause disease. For Pseudomonas aeruginosa infections in humans, we can see the lesions of green wound from the production of both pigments, and the pus will present in green. Yes, for veterinary importance, especially in small animals, Pseudomonas aeruginosa can cause skin and wound infection, and the lesion is more severe than Staphylococcus. This can cause the deep pyoderma and multifocal. Yeah, you can see the more severe inflammations in the deep layers. And the lesions will present at not the colonization area of Staphylococcus. So this is the dorsal of the dog. This is a case of Pseudomonas aeruginosa infections in a boxer. The dog presents lethargy and less appetite. From the physical examinations, there are papilla focally crusting dermatitis at dorsal. And from the previous, the dog was treated with the immunosuppressive drugs and antimicrobial drugs for skin allergy and staphylococcal infections. Okay, and 7 weeks later, developed the lesions of papilla dermatitis. And this is the histopathology of the dog. You can see the inflammation with the presence of white blood cells from epidermis to dermis. This is the pyogranulomatous inflammation of both superficial and deep dermis. And the bacterial culture show the PO culture of yellow lime colonies with the motile bacteria and strongly oxidase positive results. Observed from the histopathologic lesions, there are rod-shaped bacteria that are consistent with the bacterial culture results with the presence of white blood cells. This is very active lesions. So this is the pseudomonal pyoderma. Not only causing disease in small animals Oh, sorry, we need to change this to be Pseudomonas aeruginosa. The transmission of antimicrobial resistance bacteria between dog owner and the dog in the same household was reported. And the strain of the Pseudomonas aeruginosa is carbapenem resistant because the dog owner was ill and was admitted in the hospital for up to 5 months. So this is a risk of the dog owner to acquire carbapenem-resistant Pseudomonas aeruginosa strain from the hospitals. And then when the owner discharged, okay, and stay at home, one of the dogs developed otitis externa. This is the inflammation of the ear. So the vet, the vet collect a sample and send to the lab, and the positive agent is carbapenem resistant Pseudomonas aeruginosa. This is uncommon to see carbapenem resistant bacteria in veterinary medicine before. So why the vet also track the history of the dog owner and found that they have the history of hospital admission that is the risk to acquire carbapenem resistant Pseudomonas aeruginosa, and this can be transferred or transmit to the dog and cause disease. And from the investigations, they also collect the samples from oral mucosa and from the feces, and dog number 2 found positive. They confirm the transmission by DNA fingerprint analysis, and strains from humans and from dog show the same. So they report in emerging infectious disease. And for Acinetobacter baumannii, in vet, this is an emergent antimicrobial resistant pathogens. A. baumannii is very important in human hospitals as well as the Pseudomonas aeruginosa before. They cause the hospital outbreak worldwide. And now this species spread into veterinary hospitals and cause various forms of disease, such as urinary tract infections and surgical site infections. This case is a dog that underwent surgical surgery, the orthopedic surgery with orthopedic implantations. This is a Chihuahua. And then after surgery, the dog developed surgical site infections. Okay, this is very invasive. So you can see, so I show in only the monotone, from bacterial isolations and antimicrobial substitute testings, we isolate Acinetobacter baumannii that show carbapenem resistance with the presence of extensive drug resistance phenotype, and the bacterium show susceptible only to gentamicin. So we suggest this drug. And then we can see the improvement of the lesions. But gentamicin is a nephrotoxic, so we need to monitor the kidney function also. Okay, and this is a worst case of a dog that developed urinary tract infections caused by Acinetobacter baumannii. This strain resist to carbapenems or imipidines here and show resistance to all drugs tested. So we can say this is pan-drug resistance or PDR. In this case, we cannot use the veterinary antimicrobials for the treatment. So this is an antimicrobial resistant threat in the veterinary medicines. For the antimicrobial resistance that were reported in companion animals in many species, especially the ESKAPEE pathogens. We can see the report, many reports are the transmissions about the transmission between dogs, cats, and their owners. And also, especially the resistance to last line antimicrobials. The contaminations of escape pathogens in the veterinary setting can cause nosocomial infections and can also make the patient be colonized with antimicrobial resistance bacteria. And after discharge, dogs and cats can be carriers and also excrete the AMR bacteria into the house in the household environments and also the communities. And the consumption of raw meat, this is a trend, this is a risk. Okay, this can also be a new pathway of bacteria from livestock to pets and also to humans. So the AMR bacteria are considered the One Health because of the spread of the strains and also of the antimicrobial resistance genes on the plasmids. That why we are talking about this topic today. Okay, thank you very much. I think that's all for my lecture.
Okay, thank you very much, Achan, for the excellent lecture. We will now continue with the discussion session. For participants, we have a question in the chat box. Should we continue, Achan?
Yes.
Okay, from Endah Cahyani. She asked for recently climate change has also been recognized as a factor influencing the spread of infectious disease. In your opinion, could climate change also contribute to the spread of antimicrobial resistance, bacteria such as MRSA, VRE, or resistant enterobacter among humans, animals, and the environment? Yeah, you can answer, maybe, Achan.
May I just repeat about the question again? This is about the climate change, right?
Yes, right.
Can affect the spread of infectious diseases and also the antimicrobial resistance bacteria.
Yes, right.
Okay, for the climate change, and of course, this is a factor that can promote the spread of an anti of the infectious disease, especially from the temperature that from the equator to other parts, right? But specific to the AMR, I think the higher temperatures in the environment can also promote the bacterial growth. And also for the environment such as in Thailand we have the problems about the small dust, the PM 2.5. Okay, especially during the in winter here, the particles are identified to be like a mode of transmission of AMR bacterial AMR genes.
Okay. The next question is, do you think wildlife should also be included more actively in AMR surveillance program? Could wild animal become an important reservoir or carrier of resistant bacteria that are often overlooked? You can answer. Okay.
So sorry, Shruti, I cannot hear the second question
Okay.
clearly. Would you repeat it?
The question from Enda, still Enda. Do you think wildlife should also be included more actively in AMR surveillance program? Could wild animals become important reservoir or carrier of resistant bacteria that are often overlooked?
The question is about the surveillance program in animals, right?
Wildlife animal,
In wildlife, yes.
wildlife.
Okay, for the wildlife, I think the problems should be for the problems in wildlife. This is my team is studying in zoo, and we are focusing on the transmissions of the AMR from animals to humans also. So for the bacterial species, we will focus should be based on the target bacteria in humans, like especially enterococci and E. coli, like I present before. Those are the bacteria that represent the populations and the resistance because they can be found in many animal species in the intestinal tract. This can reflect the development of the resistance in many animal species.
Okay, so the wildlife can become the important reservoir, right, to human.
Yes,
Uh,
they can be because many reports also found the resistance bacteria. Uh, if we remember the colistin resistance uh, in Australia, they have not found the colistin resistance from domestic animals, but they found from migratory birds. They
okay,
can
very
be a
clear.
resistance. Yes.
Okay, very clear. The next, we learned that resistant genes such as MEC and FAN
Yes.
play a major role in antimicrobial resistance. Recent studies suggest that these genes can persist in the environment and spread through horizontal gene transfer. In your opinion, should future AMR control strategies focus on not only on reducing antibiotic use, but also on monitoring environment reservoir of resistance genes? How about this, Ajahn?
Um, Morning. Of course, for both animals and environmentals on environment are the reservoirs of the resistance genes. For the use, uh, the promote the judicious and prudent use are the strategies to reduce. But for the environment, we need to identify what is the important sources of the resistance. Yes, and for environment, it's a bit hard to monitor, more difficult to monitor because it's more dynamics. And um, for this, we are working with the FAO. yeah, they will launch the guideline about the monitoring of AMR in the environment with the focusing on wastewater and in farm. So now I think many groups are working in research.
Okay, Achan. This is about water. Do you think environment surveillance such as wastewater monitoring should become a routine part of One Health AMM surveillance in the future?
Yes, yes, in environment also, especially in farm environment and in aquatic, right? In aquatic animals and fish farms. And for human size, they also monitor from the wastewater from healthcare settings to
Okay,
like to reduce the spread. Mm.
okay, okay. Thank you, Enda. The next turn from Amila. I heard that it was the most evil bacteria that is capable of directing its own mutation of particular gene in order to manufacture a particular type of protein as transporter or enzyme, as they could be much more resistant toward antibiotic given, making it adaptive and on any type of antibiotic. My question, how exactly you design antibiotic for some bacteria that is able to evolve in such way?
For the mechanisms, yes,
Yeah,
yes,
yeah.
for the mechanisms, um, the highly concerned and studies the multi-drug resistance mechanisms like the efflux pump, the proteins on the bacterial cells that can export, and many antimicrobial molecules, yeah, outside the cells. And for the genes, they are dynamics and they can be transferred among bacterial species. So why that we need to monitor and do the surveillance. And now there is whole genome sequencing analysis. We can know the mechanism easier than the past, and we can identify. And anyway, we found many resistance gene and resistance mechanism over time.
Yeah. Okay. Okay. Thank you, Nahla. Thank you. The next is from Sulistiani. Um, why is it that when an animal is already sick and its condition has significantly deteriorated, administering medication or antibiotic actually cause its condition to worse, sometimes even leading to death? Has the animal developed resistance? Um,
So I'm reading the
yeah,
question.
yes, yeah.
Condition has usually deteriorate, and reason actually caused. Yes, it depends on the conditions of the animals also. So when we test the antimicrobial society testing, this is only in vitro. This is only in the lab. Yeah. Um, for in clinical conditions or in clinical cases, there are many factors, such as the systems that involve with the infections, and also the animal conditions. They are immunosuppressed or immunocompromised or not, right? And the clinical outcomes is not based on only from the lab results. Mm. So, but we need to have the rigid diagnostic to identify what is the true problems. Okay, and we need to prioritize what we need to treat first to um help the animals. Make them leading the date. No, this the development of the resistance can we will know after we do the susceptibility testing and to for choosing the right drug to help to save the animals. But we cannot, it's very hard to identify that the bacteria develop resistance inside the animal body and cause worsened and death, fatal outcome. Yeah.
Okay, thank you, Achan. Thank you, Tia. Thank you, Tia. There is question again from other students or participants. I'll give you the opportunity to ask Achan directly. Please raise your hand or uh, uh, type on the chat box. Okay, Achan, I have a question for you. From your perspective, which ESKAPEE pathogens should receive the highest priority for surveillance and infection control in veterinary setting, especially in small animal hospital and or pig farming system? And what are the main reasons for prioritizing this pathogen? Yeah, thank you.
For prioritizing, right?
Yeah.
I think now it's the same to the priority from the WHO. Yeah, in veterinary medicine, we found the trends very similar. Now the gram-negative bacterial species, especially Enterobacter and Acinetobacter, are higher. And also the spread of the carbapenem resistance and the third generation cephalosporin resistance. That's why my research group is focusing on these two groups, two species, Enterobacter and Acinetobacter. Yeah.
I think there is no question again, Achan. I'm in the YouTube. There's no question again. Um, Maybe we can close the session today. Is it okay, Achan?
Yes, thank you very
Okay.
much
Okay.
for
Okay.
okay.
Before we close today's session, allow me to briefly highlight the key message from today's lecture. Through this lecture, we learned that escapee pathogens are clinically important bacteria in veterinary medicine, especially because of their role in opportunistic infection, hospital-associated infection, antimicrobial resistance, and One Health-related transmission. Achan also emphasized the importance of proper bacterial identification, antimicrobial susceptibility testing, infection control, and responsible antimicrobial use in veterinary practice. We hope today's lecture has provided valuable insight for all participants, especially in understanding the connection between veterinary microbiology, animal health, public health, and antimicrobial resistance. Thank you very much, Dr. Patrala Chancheto, for this insightful lecture. And we have now come to end of today's guest lecture. On behalf of the Faculty of Veterinary Medicine, Universitas Brawijaya, we would like to express our sincere appreciation to Associate Professor Dr. Patrara Chanchetong for sharing his valuable knowledge and expertise with us. ขอบคุณค่ะอาจารย์ thank you very much. We would also like to remind all participants that this guest lecture series will be continued on 27 July 2026 with two upcoming lectures. First is key point for bacterial identification and antimicrobial susceptibility testing in veterinary clinical microbiology. And second, antimicrobial sensitivity testing or AST panels and interpretation in small animal veterinary practice. This session will be conducted in a hybrid format as Dr. Patra Chetong will visit us directly in Malang. We are truly looking forward to welcoming him in person at the Faculty of Veterinary Medicine, Universitas Brawijaya. Thank you to all lecturers, students, and other participants for joining today's session. We hope this lecture has provided valuable academic and clinical insight, especially in veterinary microbiology, antimicrobial resistance, and One Health. Have a wonderful day, good morning, and see you in the next session. ขอบคุณค่ะอาจารย์
See you
Thank you
soon.
very much. See you soon.
Have a nice day.